Everybody, we're here on Facebook Live and we just punched on Instagram Live. I'm really happy everybody could check in. This is going to be an exciting topic. Little shout out to my buddies at Arconia. You promised you're watching. I hope you are. So here we go. It's Super Bowl in 2 weeks. It is the Super Bowl in 2 weeks, the most watched event worldwide. And people are talking about the Super Bowl, and some of the players, or a lot of the players in their careers, have had a concussion. So today is my early Super Bowl special where I talk about concussions. Concussions has been in the news, especially over the last couple of years. We had the Will Smith book, and a lot of people want to know how to diagnose and treat it. But when you really think about it, we have some specific diagnosis now, but how do you get it treated? Most people think it's rest, and you're going to find out today it's not rest. I'm going to show you a three-prong effect, how to treat and get great results with concussion. Number one, what is a concussion? Well, I don't really just want to tell you what it is. Most people don't understand, and if anybody, please feel free to email me at info@drrobertsilverman.com. In that, I will show you a videotape of somebody getting hit in a football game. Remember, they don't get hit in the head. They got hit in the side and the head whipped. So what you have to understand is the skull obviously is a very hard bone. When you consider that football players have the most number of concussions and cyclists have the highest percentage amount of concussions, both of them wear helmets, yet they're still getting concussions. Now the helmet protects the skull from skull fracture, which is huge. However, the brain, which is only 3 pounds, it's 3 pounds. It's like a sort of a hard jello and a best day. When it moves around after you get whipped back and forth, that brain, which is like jello, starts to split and tear. The brain can tear up to 50%. So when you think about it, it's the whipping of the brain and the tearing that poses the problem. I have a great video on that. It was in the New York Times. So it's not just the impact to the head, it's the whip of the head. Grading, we have 3 grades. Grade number 1, mild symptoms, less than 15 minutes. You're still conscious. Level 2, grade 2, more than 15 minutes of symptoms. And grade 3, get knocked out. You lose consciousness. So you have those 3 levels. Your symptoms are interesting in that obviously you're not cognitive, you don't know where you are, you ask people the date, you're nauseous, you're getting headaches, you're very susceptible to irritation of the light to your eyes. So these are tremendous symptoms. Headaches, like I said. Gastrointestinal problems. That's going to be a huge takeaway what a concussion causes. Gastrointestinal issues. Concussion tests. Forbes magazine, August 24th, 2016, published 2 tests. It's the pediatric, it's the cognitive test. My God, I'm here on Facebook Live and I forgot the name of the test. It's a test they give you in the school. John, you got to know it.
Pediatric cognitive test sounds pretty good.
Pediatric cognitive test. You guys are going to fill it in. So it's a test that you take in school where you write and you see your cognition. And there's one for adults and there's one as a baseline for children. In addition, why do we have increased concussions? It's a great question. Because in my day, we didn't have them. Well, number 1, clearly, we are testing for them. Number 2, it's something called diminished brain resilience syndrome. What do you mean by that? People are more susceptible to concussion. Number 1, we're getting them more often, so you have a higher susceptibility when you have the first one of 1.5 times chance of getting the second. If you have a second, you have a 3 times chance of getting the third. But that brain resilience syndrome or diminished brain resilience syndrome, very interesting in that it goes to the fact that the brains aren't quite as hard. The environment is causing tremendous problems. Our gut flora, remember the gut and the brain, we've talked about that in other Facebook Lives, are attached. The gut flora poses a problem. Your liver enzymes. So essentially, your body and your systems are failing and not supporting your overall brain health. So if you have a gut problem, the permeability, your gut lining is the same protein as your brain lining. We're going to learn about that in a little while. And within that, you're more susceptible to damaging your brain. You're more toxic, you're more inflamed. So let's move on. Let's see what I got on page 2 over here. Well, women's brains are tougher from recovery. Women are more susceptible to concussion. Number 1, they report more. Number 2, they have weaker neck muscles. So when they get hit and they get whipped, they whip harder, they whip quicker, they have more of a stretch, and that stretch causes more of a tear. And number 3, hormonally, women are put together different than men. Men are mostly testosterone based. Women are estrogen and progesterone based. The last 2 weeks of their cycle is a progesterone based, or should be progesterone based portion of their cycle. Progesterone has a positive healing and calming effect on their brain. When they get hit, like when they do in a concussion, it shuts the pituitary gland off, and the pituitary gland does not allow any estrogen or progesterone to be released after trauma, and they can't respond to trauma as well because of their hormones. It's something that's called withdrawal hypotheses. So women are more susceptible to men to concussion for those 3 aforementioned reasons. In addition, when you get a concussion, interesting, in college athletes, they have an increased chance of getting a lower extremity injury, an ankle sprain, a knee injury, or hip injury, because after a concussion, as you'll see, you've got to do proprioceptive training. Proprioception, the balance between your nervous system and your muscular system. Understand, or your sense of where you are in space. And suicide rate, interesting, is increased. 1 single concussion can increase the suicide rate in an athlete or an individual 3 times, and if you're just a weekend warrior, it would be 4 times. So clearly we need to treat these concussions. Diagnosis increased in teens. Teens are without question the highest group of people that are getting concussion rates. They're 5 times higher than any adult rate. So that 13 and 19 age bracket is, unfortunately, I hate to use the term sweet spot, is the area where people are getting injured. And finally, brain changes in youth without concussion. They did a study from kids from the ages of 8 to 13 that played football that had no diagnosed concussion, yet they already had brain damage, just the trauma. So you don't have to get a concussion, you just need the whipping of the brain, and that is extraordinarily disconcerting. Let's move on. Well, here's my Dr. Rob's concussion protocol. Let's start number 1, musculoskeletal. Guys, I'm a chiropractor. So guess the literature speaks to the number 1 muscle that you want to release and work with in the occipital triangle is the rectus capitis posterior minor, because that actually attaches to the skull. The other muscles in the triangle attach to the dural sheath, and they have an effect on the spinal fluid, cerebral spinal fluid. So the rectus capitis posterior minor is the muscle that you're going to want to work on. Number 2, balance, proprioception, balance training. Balance training, getting on a rocco board, a wobble board, standing on 1 foot. In addition, visual disturbances, something called gaze stabilization. Exercises to do gaze stabilization to help use your eyes and your visual cortex. You can get these all under what we call the rehab category. Great place to go get the exercises. They use them every month. Big shout out to Web Exercises. I did a webinar for them on concussion. In that, they've got 6 to 8 exercises that I use in my office all the time for rehab. So big shout out to David Cruz at Web Exercises. Now we're really getting to the panacea of health. Laser, low-level laser therapy. Not the hot laser. Here's the differentiation. Everybody talks about cold laser. The laser, the Erconia laser that I'm going to talk about, doesn't generate any heat. It's a light laser. It works at cellular levels. It allows for cellular physiology. So it's fabulous. We all know that light at the right temperature, at the right wavelength, has a healing effect. So laser is going to be a major component. We're going to go over different studies, and I apply it on all my concussion patients to get outstanding clinical outcome. The laser is very simply, light is flashed at the body. The cell membrane absorbs the light, takes it into the cytoplasm, gets to the nucleus, and we're getting physiological changes. We get cellular communication and upregulation of muscles. We're healing at a physiological cellular level, so there's no heat, there's no oscillation, there's no vibration. Nutritional support. Key component. We're going to have 10 different supplements. It's a lot to talk about, and I'll go through the pathways, how this will help heal the brain. What's fascinating, what you're going to love most about laser and nutrition, great combination with the rehab, is that the goal is to get neurogenesis or upregulate BDNF, brain-derived neurotrophic factors, a protein enzyme. If you can get that upregulated, you're going to get neurogenesis. So nerve cells, brain cells can regenerate, which we never knew. Dr. David Perlmutter talks about that all the time. He's a neurologist, a functional medicine neurologist. When he went to school, nobody knew about that. This is kind of like 2013, 2014 up through now. So you can regenerate brain cells by upregulating brain-derived neurotrophic factors. There are two things that I know that do that. Low-level laser that doesn't provide heat like Erconia, and nutritional support, specific nutrients pointed at that. And let's go through all that. Don't forget the proprioception, guys. I thought we covered that in nice detail. So laser, how does it work? I think I kind of talked about that, but you know, a lot of people ask me, and essentially laser is based on Einstein's law of physics. So if you understand Einstein's law of physics, there's a nucleus, and I don't want to get too heady on Facebook Live. There's two shells of electrons. When you use a laser, a photon comes in. They call that like the power of one. A good laser gives you 45 billion photons. It excites the inner shell of the electrons. It's outside, but it's the inner shell. That electron pops to the outer shell, which is an excited shell, and goes to the next cell. And now you've got this cascade, or this power of one. Best example I can give, actually the one I use in my book, Inside Out Health, real simple. Somebody counted and found out there were 18,942 mouse traps that could fit on a football field. Yes, somebody has too much time on their hands. And in that mouse trap, which is your cell, you've got one ping pong ball. You put it on the mouse trap. John and I are hanging out on the sidelines before Tom Brady comes out, and we got 45 billion ping pong balls. John says, I'm going to throw them all in there. I'm like, John, don't worry about it. Watch this. I take the one, boop, throw it in the air, and what happens to all of them? You have the cascade. That's how laser is going to work. It allows via cellular, and that's where the word cell comes from, 1 to 2 to 4, etc. In addition, let's talk about some research studies about laser therapy. Number one, it's been proven to increase neurological performance in traumatic brain injury. That is a concussion. 2, effective in the reduction of pain and inflammation. The FDA clearances dictate that we have decreased pain, decreased inflammation, and increased range of motion. Modulates oxidative stress and nitric oxide. Oxidative stress, unfortunately, when released, causes plaquing. And plaquing in the brain is really one of the reasons why you lead towards Alzheimer's disease. In addition, downregulates cytokine expression. Cytokines, all these different interleukins, they're inflammatory markers that hit the receptor site in the cell, and they lead to a cascade of inflammation. So when you downregulate cytokines, you're decreasing inflammation. 635 nanometers, that is the wavelength of visible light. The laser at Erconia that we've talked about allows for the 635 visible light, and that is shown through multiple studies to modulate NF-kappa B. NF-kappa B is the signal transducer of inflammation in the cell, and that's how it decreases inflammation in the cell. It allows to stop or slow down cell death, which is great. We don't want our cells to die, because if they're still alive, they're easy to rejuvenate. In addition, suppresses all those interleukins. Those interleukins are subkines or subtitles, if you will, under cytokines. Upregulates, 2013 study, brain-derived neurotrophic factor. So use laser if you want the brain to heal. And finally, ultimately, heal the brain. Let's get to the nutritional protocol. Protein, eat a high level of protein. Protein helps the brain heal. You want about a kilogram to a gram per body, a pound per body weight. So you want to eat some protein. Protein helps it heal. Creatine, it aids in brain recovery. Creatine is shown for short-term TBI, traumatic brain injury, to help with short-term amnesia. So 5 grams of creatine is a great choice. DHA. That's a fish oil. That's an omega-3. It's shown to decrease brain inflammation. DHA is a critical element to help with cell membrane health, and your brain is the fattest organ in your body, so it'll help with cell membrane health. In addition, if you want to decrease inflammation in the brain, you also would use like resveratrol, grapeseed extract, bromelain, turmeric, and boswellia. All herbs that have been proven over time to have an anti-inflammatory effect, hence an anti-inflammatory effect on the brain. Alpha-lipoic acid is an antioxidant. It keeps blood sugar down. We'll talk about, or everybody should know that if your blood sugar is high, it's adverse to your brain. Sugar is a toxin. You hear me say that every week. Alpha-lipoic acid is the only antioxidant that works with the fat in the watery part of the cell. So alpha-lipoic acid is a great choice, 600 milligrams. Choline helps with brain development. We know that because it's in all our pregnancy vitamins for women. Vitamin D is extraordinarily neuroprotective. It puts the brakes on inflammation. Zinc is a great enzyme. Most men are deficient in zinc. Zinc is a great enzyme for the central nervous system. Magnesium. Magnesium enhances synaptic density. Special kind of magnesium. Magnesium L-threonate has been studied in September of 2016. It's the only type of magnesium to pass the blood-brain barrier. It allows it to get into the cerebral spinal fluid. When you have a leaky brain and the membrane's injured in your brain, it goes into the cerebral spinal fluid. So if you have a compromise of your blood-brain barrier, all those toxins and exudates go into the cerebral spinal fluid. If your gut's on fire and damaged, it goes into your bloodstream and hits you systemically. Acetyl L-carnitine energizes brain. Glutathione, the body's biggest intracellular antioxidant. It was shown in a study in Sports Illustrated in 2014, April, to decrease brain tissue damage by 70%. Now, the big takeaway with glutathione is very simply, you can inject it, you can't take it orally, because if you took glutathione orally, the stomach acid kills it, so you need 5 different nutrients to make glutathione. So, with that being said, some food for thought. Here's a big takeaway. Traumatic brain injury equals intestinal lining. So guess what? If you hit your head, you damage your gut. Within 6 hours, Brown University has said you have brain cell damage after a concussion. Your gut is damaged within 3 hours. It releases something called LPS, lipopolysaccharide, a gram-negative bacteria. Not, again, to get too technical, but LPS, the release of LPS systemically causes overall inflammation. If you hit your head, you damaged your gut. So that's why people come in and they look at me and I have a full composite concussion protocol. So if you know anybody who needs any concussion help or has a concussion or has had a concussion, tell them to give me a call. A quick example of that is I had a young 13-year-old boy, rock climber, and he came in and he has all psoriasis. And I said to the mom, how long has he had it? 2 years. Have any concussion? Yeah, I had 4 concussions 3 years ago. Since the concussion, he damaged the brain, he damaged his gut. Psoriasis is a byproduct of having a compromised intestinal tract and leaky gut, and now you're seeing the whole spectrum. But what talks between the two? It's called your vagus nerve. Your vagus nerve is your walkie-talkie between your brain and your gut. Got a couple of protocols to help with vagus nerve. Just yesterday, saw an article that talked about when the vagus nerve is decreased, like when you hit your head, all digestive enzymes are decreased. So your digestion is adversely affected. And that's why these people are getting nausea and those gastrointestinal issues when they hit their head. Blood tests for concussions, blood-brain barrier permeability, Cyrex, array number 20. Blood-brain barrier protein, IgA and IgG. We're looking for autoimmunity. Ongoing damage means it's there chronically. Blood-brain barrier protein, IgM, you got a recent onset damage. Exercise for brain health. What's the best exercise for brain health? Surprisingly enough, the best exercise for brain health is long-distance running. It gives you the most neurogenesis. High-intensity training or high-intensity interval training is outstanding. However, it's not as good for brain health as long-distance running, and weightlifting doesn't give you any brain health. That doesn't mean they're not good. We're just talking specifically brain health. When in doubt, sit them out. If you're not sure and your kid got hit in the head, when in doubt, sit them out. And finally, complete rest is not the answer. Studies have shown that within the first week, You got to get people exercising. You just don't want them to have trauma. So you're thinking about what you have. You're saying, have I ever had a concussion? Should I give somebody a call? Give me a call. 914-287-6464. Dr. Robert Silverman. Obviously, you're on Facebook Live. You can get my email me through my website, which is www.drrobertsilverman.com. If you have a leaky gut problem, you may want to talk to me, and you may be able to attribute it to your head. Just remember, if you have leaky gut, you got a damaged brain. If you have a damaged brain, you have a leaky gut. I hope this gave you some information and some breakthroughs on concussion. You've got a lot of options out there, and I hope the practitioners who see this come to some of my upcoming seminars. John, you got any questions?
Yeah, so with youth athletics today, what is your recommendation? Should kids be avoiding football? Are they able to play? What do you think?
Great question.
Is that the only sport also that's at risk?
Well, football is the one that we're all talking about. It's a Super Bowl special. Let's talk about football. I think they've got to make the change where they got to stop putting their head down. They say they have, but they're still hitting their head. But more than that, it's even when they hit in the shoulder. You saw that New York's time. They hit the shoulder and the head went. I don't have any kids, so it'd be curious. I definitely would, probably try, unfortunately, to stray them away from football, but you get hit in basketball. I get a whole bunch of times playing basketball, lacrosse and everything. The key element, remember, it's diminished brain resilience syndrome. Keep them healthy. It always goes back to lifestyle. It always goes back to systems and not symptoms. Everybody, we're in a toxic world. It comes back to the same thing. We're more susceptible to things if we don't stay healthy.
And you mentioned people who may have had concussions in the past and treated it in a more traditional manner. Is there still something they can do today to help that?
Absolutely. If you had a concussion 20 years ago, you can come in and we've got clinical outcome. We've seen patients from 20 years to 20 minutes. So you can get clinical outcome. Come in, get examined. Let's look at the full cascade. Got a lot of articles out on concussion, integrative practitioner, because I'll be at Integrative Health Symposium in New York from February 23rd to 25th, talking about inflammation. There'll be a portion of concussion. Definitely come see that. You're really going to find that very interesting. And also, from Mind Body Green, I had an article out on concussion. If you guys are interested, email us. John can attach them and put them out. Dynamic Carol, back in 2014, we wrote about concussion. It's in my book, Inside Out Health, A Revolutionary Approach to Your Body, Chapter 9.
All right, and let people know where they can find you on Thursday.
They can find me on Thursday. Are you ready? You can find me at 10:30. We are packed. We're going to get more packed. I'm hoping to get people outside the door. We're going to be at Green Life in Mamaroneck. Leslie and Mark, get ready, because I know you guys are calm, and I can guarantee you I'm bringing some energy that day. We're going to be talking about detox.
Cool.
All right. See you soon. Always yours in health, Dr. Rob.